Good morning, everyone. Welcome to the Braid Health webinar panel, The Future of Urgent Care, How Innovation and Technology Can Elevate the Industry. Healthcare delivery changed almost overnight in the US with urgent care systems at the front line, driving innovations faster than anyone thought possible. As our new normal unfolds, it's evident that more healthcare consumers in the US are now comfortable with telehealth services and digital health solutions in general. What does that mean for urgent care and ambulatory going forward? The broad consensus from our panelists today is that services like imaging and labs are even more vital to the future of the urgent care industry. With that in mind, our team at Braid Health wanted to support our colleagues by hosting this panel today to better collaborate and better support each other on the path forward. So who are we? Braid Health is a next generation, AI-powered, end-to-end teleradiology solution for urgent care clinics. We are actively driving costs out of the system and enabling improved patient outcomes and patient retention. We believe every patient deserves access to the best medical expertise available, no matter where he or she lives. We are the only company to offer real-time radiology reads combined with Braid Health software platform and integrated AI for unparalleled speed and accuracy. Braid was designed as an interconnected digital health platform like no other, and we're here to help, especially during this time of COVID. Let's go ahead and get started. First, let's meet our esteemed panel. I'd like to introduce our moderator, Brian Slusser. Brian is the CEO and founder of Health in Motion Network. Brian has a distinguished career in healthcare that spans over 4 decades. Prior to developing the innovation group that supports Health in Motion, Brian was in a strategic advisory capacity for a breakthrough telemedicine startup in Columbus, introducing the solution to senior pharmacy leadership as a wave of the future for retail pharmacy and on-demand care clinics. Early in his career, Brian was the CEO of Retail Pharmacy Assets. Thank you for being with us, Brian, and I'll turn it over to you.
Wonderful. It's great to be here. Really, really great to be here. And I've come to really appreciate what Braid Health is bringing to market. We just recently signed an agreement with Braid Health, but visionaries, totally, their solution is definitely the future. Just glad to be a part of this. I don't want to take any time without introducing the panel here. We've got a great group, very lively conversation today. So first I want to introduce you to Ellen Horwitz.
Hi, Brian. Thanks for having me.
And Roger, want to also introduce you. Looking forward to the discussion with you today. Roger Killer is the president, founder of Clineva Urgent Care Center in Orange County. Clineva is a distinguished UCAOA accredited system that embraces technology, drives efficiencies for concierge level patient experience. Roger and his team exemplify the modern, efficient delivery models that healthcare consumers are demanding. And thanks for taking time away from your practice to join us, Roger.
Thanks, Brian. Looking forward to the discussion.
We're fortunate to have Blake Bishop joining us from Providence, St. Joseph Health Center in Seattle, Washington, which in addition to taking a highly visible leadership role during the early days of COVID in Seattle, Providence is also regarded as one of the most innovative health systems in the country. Blake leads Urgent Care Growth and Innovation Program for Providence, which includes 75 locations throughout the Western U.S. He has an extensive experience in urgent care operator, holds an MBA in healthcare administration, and serves on the UCA Public Health Policy Committee.
Hey, Brian, happy to be here.
Also like to introduce Dr. Rajni Natesan, Chief Medical Officer of Braid Health, sponsor of today's webinar. Dr. Natesan is a board-certified radiologist from MD Anderson Cancer Center, where she drove the community expansion and partnership. She's a seasoned executive in the medical device space and started her career at Wall Street as a healthcare investment banker.
Thank you, Brian, and thank you all for joining us today.
Welcome again to all of our panelists. And I have to give a quick shout out to a good old friend, Laurel Sumnoff, who for helping us to formulate the title for this webinar, Reinventing Urgent Care, which we feel is several questions for the panel. So let's get this thing kicked off. While the shock of COVID is behind us, there's still much to learn what urgent care can do in the business model. Really, what should we prepared for to manage in the weeks and months ahead? Ellen, can we start with you?
Sure, Brian. I'm not on the ground with in-center care in my new role, but I can share with you what I've been hearing from our members in the last few months. as everybody knows, our fundamental model is built on walk-in care. So fluctuations day to day and a degree of uncertainty and flexibility is very normal for us. But the dynamics of the pandemic have really increased the highs and lows of those fluctuations, really more week to week and month to month, and the more manageable day to day fluctuations than we were used to. All that has been caused by the dramatic ups and downs of PPE and testing availability, coupled with really unpredictable public behaviors. And because we are by nature so consumer driven, and the consumer behavior still relative to COVID-19 has not really normalized, it's been hard for staff and centers and leaders and owners to really appropriately manage the patient flows, even with the huge increase in utilization of technology. So we definitely have some opportunities there. We are hearing now that most centers are at historic volumes, not just for the summer, forever. And in the weeks and months to come, based on everything that we're seeing, we really expect that volume to continue to increase as we have more and more people getting upper respiratory symptoms. As you know, this coincides with the traditional flu season. So figuring out how to effectively manage all those aspects of this is really critical in the months to come.
Well, thanks, Ellen. Roger, how's the COVID crisis changed your approach to marketing, driving awareness in your local markets?
Yeah, and COVID-19 has really totally changed the urgent care business, and particularly our business. Used to be for marketing in urgent care that the most important factor was, location, where you were. You were on a highly visible street corner, and you're on top of patients' minds. And that's still valid today, but in addition to that physical presence, now your virtual presence, your online presence matters almost as much, we believe, but is certainly, its importance has significantly increased. So when it comes to marketing, what's important to the patient today is that they can get their health information they need from their local urgent care in a really seamless and convenient manner. It's not enough anymore. They open from 8 to 8 every day, and it's convenient to walk in. Now you need to have a virtual presence that facilitates communicating with the patient, meaning the patient needs to be able to communicate with the clinic whatever way they prefer, right? Whether that's chat, phone, email, text, and so on. They should be able to retrieve their information and document seamlessly, as well as in a HIPAA-compliant manner. So, for example, in the context of Braid, what's really important to us is that we can, for example, we can send a link to a primary care physician for a radiology study without the need for the patient to come in and having to be in the clinic and having to burn a CD that they then take and bring to their primary care physician. So that's an example of a touchless digital experience the patient now expects and will expect in the future. As far as what's ahead, Ellen alluded to this, as far as what's ahead in the near term in the fall, it'll be interesting to see how urgent care in general will cope with not only having a flu season, but also possibly some resurgence of COVID-19 in the winter and fall. We think by then that patient will be much more aware of this virtual presence and how your physical and virtual presence, how they interact together. And they will really expect a higher level of efficiency from the local clinic. So if your urgent care wasn't prepared this spring, which for some patients was forgivable, it really needs to have a polished presence, virtual and physical, coming this fall.
Great insights, Roger. So you're basically saying that it's a combination of the physical and virtual presence, because one doesn't stand on its own as efficiently, right, today?
Not anymore. That's exactly what I'm getting at. It's not any longer the case that you can have a nice facility in an important location. The two have to mesh, and they have to be seamless, and the experience for the patient has to be a unified one.
We're hearing that. Awesome. That's really good insights again, Roger. Dr. Natesan, I got the same question for you. What are you hearing from your customers?
Yeah, it's a great question, Brian. We're hearing from our customers, both the urgent care centers themselves and their patients, that it's definitely not business as usual. We're finding, similar to what Roger said, there's a need to innovate in the interaction model with the patient to make it faster, more seamless, allow patients to get in quicker, get results quicker, and get out. And I think because of these needs, that appetite for innovation is actually stronger than ever, even in the face of increasing patient volumes. And so just an example, we've responded to that need for rapid turnaround times on medical imaging. We're really excited to provide clinics with that real-time read for the first time ever. So much so that when a patient gets a chest x-ray in the setting of COVID, for example, a Braid radiologist can interpret that image and finalize a report in just 5 minutes. And speed, access, and efficiency are all just so paramount during this time. And we're also seeing technology play a tremendous role in meeting those priorities. We found that while our customers are asking for innovation, they also want to make sure that innovation doesn't disrupt their workflow or workload during this challenging time. So we've made an intentional effort to innovate on that level too. We've taken an install process that can take weeks or months and simplified it into a 15 to 20 minute go live that can be done anywhere by anybody. So I think COVID has been a true catalyst for change, and we think a change that will definitely improve the provider and patient experience in the long run.
Absolutely. And we've seen an accelerant of good ideas in your solution, Braid Health, and your leadership, it shows. So again, it's the right solutions coming at the top is what we're seeing. So it's fantastic. Thanks, Dr. Natesan. This is great insight in the back of the house, if you will. Let's kind of move to and discuss the front of the house, the patients, the most important part, the consumers today. How has COVID changed the patient expectations? What are they looking for in a patient experience? And really, how can innovation and technology help? Blake, I'm going to go to you first.
Thanks, Brian. I think Roger and Dr. Natesan, have touched on it a lot and done a good job summarizing some key points to where even before COVID, of course, our patients were looking for three major things: convenience. So, how long does it take to get to you physically? Your low cost care. So you want to keep be cheaper than the ED, right? And then being friendly service. So we definitely have a huge focus at Providence, and in previous companies I've worked with are always focusing on customer service for our patients. You see that all across the country. I think the UCA does a great job at highlighting that during all of their events. But that expectation's definitely now more important than ever to keep those three things involved as we're expanding our virtual efforts. But it's no longer, I think to Roger's point, combined in those four walls. So if you don't have that digital experience or digital presence, then you're kind of behind the game a little bit. Thankfully, we have a lot of good resources at our company, but just finding ways to partner with great companies like Braid to find ways to improve your current usage. So, I love the turnaround time, moving it from 20 to 30 minutes to 5 minutes is phenomenal. So finding ways to optimize what you currently do is kind of a good real world example of how technology can help improve the patient experience.
Wonderful. Llewellyn, with your experience across healthcare, vast experience, 25 years in health systems and working in healthcare, and you being one of the founders and first executive director of UCA, we really would love your thoughts.
Of course, I'm going to agree with Blake and Roger and Dr. Natesan. It's interesting. Patients have adjusted their desired experience somewhat, but not entirely. They want to feel safe. That's definitely number one. And their requirements for what that means have probably changed. But immediately after that, they want what they've always wanted, which is to feel welcomed and special and taken care of. Pandemics notwithstanding, they don't care. All the extra things that it's taking us to get there, they still look at this through their lens, as they should. And so we have to find new ways to deliver that now. From a technological standpoint, I think the most important thing is what has already really been brought up, is that end-to-end experience should feel like parts of a connected whole and still have that one-stop shop feeling that we've wanted to be since the beginning. And, one of the limitations that we see in some solutions that are out there, the standalone telemedicine technology, is that, without having that relationship with a brick and mortar facility, if your telemedicine visit results in the need to have hands-on testing, it's very possible you'll feel sort of left on your own to figure out what the next stop is. And that's really what I like about where a lot of this is going, is having that pre-established relationship with partner urgent care centers makes that actually seamless for the patient in a way that they already demand. So I think that's, a big part of where our opportunity is that differentiation that we have in that area.
Absolutely. Llewellyn, again, your experience brings a lot to the table in those kind of conversations. You look at what had just happened. You look at a company like Teladoc paying $1.8 billion for Livongo. Again, these are the things that are coming and competing with. And again, you have great insights and insights to how to help urgent care compete with it. And it's the human touch. It's people in the community and they've been there for some time servicing patients. So fantastic. Question for you, Roger. We've seen an uptick in technology adoption from EMR, telemed, teleradiology during this pandemic. What technology have you implemented in this time of COVID? And really, how can technology keep patients safe? And just as important, keep providers safe during this challenging time.
Mm-hmm. Yeah, fortunately for us, we had a telemedicine solution ready to go prior to COVID-19. So we already had stood up what we call video visits as a service line, I would say 6 to 8 months prior to really the pandemic starting to accelerate. So we hit the ground running, so to speak. When we became aware of the pandemic, we immediately put protocols and procedures in place to create a safe environment for our patients as well as our staff. Very importantly, we started, of course, to immediately screen every patient when they came in for symptoms, and if they met the criteria for COVID, we asked them to please go to their car and register from their cell phone with the clinic, because we have a portal that allows them to do that, which is extremely helpful. And in the beginning months, if you remember, there was a lot of confusion from the patient side as to what they were able to do and not to do, and if they should come to the clinic or not. So there's a lot of confusion there. So we asked them when they came in and they had some, we asked them to go to the car, and we would initiate a video visit with the patient, and if necessary, we would send an MA to the car, in full gear, to treat or test the patient, as necessary. Additionally, we created sort of in-clinic virtual rooms, kind of pods, where the patient who came to our clinic was able to go into an exam room and see the provider remotely if they wished to do so. They really needed to be in the clinic, but wanted to limit the interaction. We gave them that choice as well, and also that served as a way for us to load balance patient care, particularly when we saw these huge upswings in testing. This allowed us to really effectively divide and conquer, if you will. So as a result of that, we started really improve on throughput times with having implemented these technologies, and additionally always kept our eye out for services that are more efficient, faster, while maintaining the quality of service. So for us, it's always been that every second counts, every second of the patient encounter counts. But in a pandemic, that is obviously amplified as you're trying to limit the time that the patient spends in your clinic. You limit that for the patient's sake as well as for the sake of our staff. Since we, for example, when it comes to radiology, since we have a radiologist look at every study that we do, quality and speed has become a really important service criteria for us. So in the case of, during this pandemic, in the case of the patient needing an x-ray, it became extremely important that the patient did not spend a lot of time in the clinic waiting for the radiologist to do the read. So the ability to really have fast turnaround times and provide a touchless experience, as well as minimizing time in the clinic for the patient, that really became a focus.
Roger, your business is made based on experience. The urgent care centers you set up are as described almost like a spa, right? So for you to introduce virtual health and some things that can lower the quality of care in many people's eyes. So you've been able to hold that and elevate that experience. So that's tremendous. It really is.
And to interject what Llewellyn said, it'll be interesting to see. Our experience has become that telemedicine is more an extension of our existing business, It remains to be seen whether it can be a viable standalone business like the teledocs currently are putting out there. What we noticed that almost every encounter needs some sort of a follow-up that just it really needs a local brick and mortar business to support that virtual business, virtual visit in most of the cases.
Yeah, I'm here to back you up on that because it's really, the teledoc solution is not new, and its utilization proves out really what telemedicine can do as a standalone, which is not a lot. Ellen, what are some of the barriers you've heard during the pandemic? What solutions that really were identified as workarounds that you found effective from your members?
Yeah, early on, really the lack of access to tests was the first barriers. Urgent care wasn't recognized as being one of the first places patients were going to go. So there was a lot of having to turn people away. That was a big, big miss. The centers really had to work hard with their suppliers to get tests. And there's lots of stories out there from a workaround standpoint about having to dedicate a full-time staff member to work the phones on that for days on end to be able to, to get up higher in the tree for distribution for those. So that was pretty tragic for several weeks. Really the second barrier was the flip side of that, of PPE availability. Once we got all the tests, those supplies were being really earmarked for hospitals and the temporary hospitals they were setting up and stadiums and such to help relieve the hospitals. And so there were shortages on that as well. And that was, again, the same approach, really. There's been a lot of really digging in out there in the industry to just work those relationships and work the phones and try to track down. There's even been supply sharing that we've seen among centers within the same geography. So that was great to see the industry come together like that. The last barrier that we're still struggling with is having a good system in place, either at the payer level or the federal level, to cover the cost of administering the proper tests needed for early identification and fast identification of COVID positive patients so we can actually stop the spread. We don't have a workaround for that yet. There are multiple issues with global contracts, making it hard for centers to be able to get paid for the tests, which are expensive, and not great systems set up sort of on the back end of that from the federal standpoint or the payer community on how all that is going to work on the back end so that all patients can have access to testing. So we're spending a lot of time right now reaching out to legislators to make sure this gets changed in the next wave that comes around.
Fantastic. Really appreciate that. Bloomberg just released an article that 10,000 plus urgent care centers were bypassed as care centers during the pandemic. Weren't identified as care sites. What opportunities do you think really do urgent care centers have to better position themselves, not only in the world of COVID, but beyond? How can you take this opportunity of being a critical element of the marketplace and go forward with it? Blake, I'm going to go to you first.
Yeah, that's a good question there, Brian. It's basically, how do you stay relevant in your market? How does the industry stay relevant? Which I think the UCA has been phenomenal in getting themselves and all of our centers across the country, in front of the right people, I think, to get our voice heard with CMS and with other people who kind of dictate what the payers end up doing. So our urgent cares along the West Coast, we definitely saw that dip as well. We anticipated incorrectly that initial spike would last. So back in March, late February, quickly, I believe, just like the rest of the country, we lost a lot of visits. And people started to reconsider how are we utilizing our urgent cares? Do we need to all stay open? I saw quite a few companies in Seattle close doors of a couple locations. I think some have reopened now. But it's been really, really interesting to follow those trends and just to see the public perception of urgent care and to even just see text messages I get from friends and family asking, should I go in? Is it safe? So we still have a lot of work to do on the industry side of public perception. And I think that really starts with just relationships. So relationships with those that you know personally, professionally. LinkedIn's obviously a great way to help build that. And then just relationships between your centers and other health systems or other privately owned urgent care centers, OCMED centers, even the pharmacies, of course. We all play a huge role in creating those relationships now, will better position us in the future to help combat any future issues we have, such as this. And the second thing I'd say is just get out of the box and try to get out of your comfort zone. Like getting out of your comfort zone to me is what being innovative means, because you don't find people too many times that can kind of reinvent the wheel. I think Braid excluded, who's reinventing the way we do overreads. But there's a lot of ways that we're gonna kind of push the envelope and find new ways to utilize technology to help position urgent care as the place to go for any future pandemics, God forbid.
Really appreciate that, Blake, and obviously great insights. You've got such an innovative base with Providence, and what you've done there, looking at innovation, pushing yourselves, hasn't been lost on you ever. So really appreciate that. Llewellyn, how do we work together as an industry? You were one of the early partners, I think actually the first partner with Gateway to Better, but how do we work as an industry to kind of elevate our voice using a resource of COVID in our community? And how do we really benefits of collaboration versus fragmentation that have really hurt urgent care over the years?
Yeah, I think the timing of this session couldn't be better. Right now, I think the best thing that we can do is stand up and speak up to our local, state, and federal officials to ensure they understand how many centers are open in their community right now and the full capability that we have, not just for COVID testing, but for all kinds of upper respiratory diagnosis and care. This is what we do. And there are 10,000 of us almost. Getting things in place for the upcoming flu season should already be happening. Specifically to what we're doing to try to really marshal the power of this big industry that we've grown into. Just today, we're issuing a call to action for all of our industry stakeholders, whether you're a member or not, to reach out to their congresspeople and representatives, governors, anyone that that may be in a position to influence someone who's in a position to make a decision on these things. It seems so obvious to us that urgent care should be a part of it. And so, but it's not obvious clearly to everyone else. And so we still have work to do there. And I think that we're activating some things today in addition to what we've already been doing. So this initiative is in our newsletter today. And we've also created, I think most of you know, a national database of centers providing testing. And that is available to the public thanks to our collaborations with organizations like Braid Health. That collaboration was announced early this morning, but that database is not yet nearly representative of every single center that's testing yet. So if your center is not on that list, please get on it today. We really appreciate Braid's help in getting the word out on this, because as Blake said, we have to find new ways to partner and to make sure that not only patients, but the people that are in the decision-making seats understand all of this. The Gateway to Better network that you referred to, Brian, is just a bigger opportunity for us to be communicating all of these capabilities on the employer side as well, because employers have a fair amount of influence in addition to, obviously having teams that need to be taken care of. Those larger employers have the ear of the folks that make these decisions. So utilizing that network is part of what we're doing as well. So thanks again for the opportunity just to I don't want to say to get the industry to wake up, but in a little bit, that is kind of what we need. We have been so local and focused on our patients, which is a great thing. But right now, politics is part of the job, part of the work that we need to do, whether we like it or not. And so I think it's time to do a better job on that. But again, we've got some exciting things coming out today, and I think we might have a preview of one of those coming up.
I think you're right. Well, you're under your leadership. You really have taken on a big challenge at the right time, right? It's a challenge for urgent care. Webinars like this really almost become industry service announcements. So really appreciate you participating today, because your leadership is important for the industry.
Happy to be here.
So I understand Braid Health has collaborated with you on a project, really raise awareness around COVID testing, as you just referred to, and how do you listing, urgent care centers across the country. I understand that this public service video has been made available to all urgent care centers today. Why don't we watch it?
No one wakes up and says, gosh, I hope I get sick and come to the doctor today.
I'm an urgent care physician in Denver, Colorado.
President of the Society for Pediatric Urgent Care.
I'm an ER doctor.
I'm a pediatrician.
Lansing, Michigan. In Chicago.
New Orleans.
Urgent care is really all about the patient.
Delivering the right care at the right time.
You can walk in and be seen.
They're able to run tests and give immediate results.
Providing greater access to patients that have needs that don't belong in the emergency room.
We're doing some things that would be considered a year ago otherworldly and not possible, but today they are.
This is our community we're here for.
It's a people business, and we love taking care of people, and we love finding solutions for them.
It's a new world we're making.
It's the era of the patient.
It's really up to us. And I love this about Braid Health is, producing something like that for an industry because they can. They're in a position to do things because they can. And so really, I'd like for you to, Dr. Natesan, kind of expand on how this collaboration came to be.
Sure, Brian, and it was great to see you in the PSA as well, taking part in that message. Braid is really a mission-driven organization. I'm really proud to be a part of it. We're deeply, deeply committed to transforming patient care for the better. And so when COVID started to spread, it occurred to us that we're just uniquely positioned to help. And we realized that the collaborative platform that we had built had the ability to connect those frontline providers with radiologists in a way that really wasn't possible before. And providers could easily work together in real time to diagnose. And similarly, we were learning that COVID test results were taking variable lengths of time to come back, from 24 hours in some areas to up to 14 days in other geographies. So Braid launched a COVID testing database for patients to be able to find those urgent care clinics around the country that offer testing, and to Lou Ellen's point, to highlight those clinics, either for testing for the virus or for antibodies. And people in our communities don't know where to go to get a COVID test. And so it's no better time than now to shine a spotlight on those urgent care centers in our own communities that are making those tests available for patients. And we couldn't be more thrilled to be doing this in collaboration with Lou Ellen and the UCA. And I think it's this type of collaboration coming together for the good of all that is exactly what's needed right now.
Well, thanks, Dr. Natesan. That COVID tester is live right now, is it not?
It is, correct. Yeah, it's live as of today.
Wonderful. It's kind of a perfect segue into our next question. Customer retentions and clinics awareness in the community. It's really more important than ever at this point in time. And what are the innovative ways that position urgent care versus being lab testing sites versus the EDs? Roger, I'm going to go to you first.
Yeah, retention of patients and creating a great experience for the patient, that comes through achieving operational excellence, right? The urgent care experience for the patient, it's sticky, meaning that, once a patient has a great experience at a clinic, they are just likely to go back there and not look for alternative solutions. So switching costs are somewhat high. That part hasn't really changed since COVID. The focus of urgent care, of an efficient, no-hassle experience, is really what sets it apart from all these other options out there, such as the emergency room, the primary care physician. What's changed since COVID is the way we interact with the patient, really, right? And that's, at the same time, is the giant opportunity for urgent care centers, because they are by nature smaller than, let's say, an emergency room. So there's an opportunity there for more personalized interaction with the patient. But as we talked about earlier, since COVID-19, patients are in addition also looking for this virtual engagement with the clinic. And, that means helping a patient with their virtual registration, walking them through it, providing, personalized service, or providing them with digital documents that they may need from the visit. So what is also often neglected is that once the patient leaves the clinic, or the provider visit is over with, there's further things to do, and the patient still needs care and attention at that time. So there's a lot of follow-up work, and this making after after the provider exam, after this, the patient has been in the clinic or seen with a telemedicine visit, making that interaction as seamless as possible, that's the key. And I think that's where urgent care can position itself and bring a lot of value to the table. Additionally, what we're seeing is that, occupational medicine right now, probably not a big topic because everybody's switching to remote work, but it will still be relevant in the future. And that has been largely neglected when it comes to innovation and technology adoption. We get calls all the time from employees that are desperately looking for solutions to keep their workforce safe. And they have the same value factors as the patients do: communication, efficiency, quality, and again, also now virtual presence. So that also, in addition, that creates a lot of opportunity, at least for us in the near term, to position ourselves in this segment.
Thanks, Roger. One big note that the panelists we have on today in the urgent care space and the panelists that Braid had on this previous webinar, very, very forward thinking. And what forward thinking about is, they talk about continuity and not just episodic medicine. It's about recurring revenue streams, recurring business, recurring patient care, being a fixture in the community, providing all these services. So it's a change. And all of you represent how urgent care is going to position and already position themselves. So again, really applaud you. Blake, what are your thoughts?
Yeah, I agree with what Roger was saying. Really closing the loop is kind of one of our main priorities when it comes to any patient that's been to Providence for the first time, or any of our joint ventures. We have a group down in California that we work with as well. We want to make sure that if patients need to follow up, that we are providing them with them resources, and we're working on doing the same thing with our virtual patients as well. So if they do need to go in for a test or a lab or blood draw or X-ray, that we're not just saying, okay, go to your nearest urgent care. We're saying, here's the link to our website, which will automatically, based on your location, show you where your nearest urgent care is, which you can then schedule online to be seen. So just really connecting those loops, finding ways to improve the continuity of care, and always improving essentially and upgrading your own technology now that what you're using. So I think that's what really interested us initially, and potentially working with Braid as the overreach side. So finding ways which improves your quality of care. If you're being able to see patients quicker, giving them that peace of mind a little bit quicker of what's going on with them, and helping them find solutions for continuing their journey and what really is a scary piece of our lives, of what that is healthcare.
Fantastic. Really, thank you, Blake. I got a final question for the full panel. And really, how can urgent care centers stand out relative to other care models? You're hearing things being called like health hubs and namesakes. Well, you're actually health hubs. You've operated as health hubs forever. So how do you actually take an urgent care clinic, looking at it from a redesign and a redefine? Look at it at very fresh. If you're starting over, how would you design your urgent care centers today? Dr. Natesan, let's go to you first.
Yeah, I think we have an exciting opportunity in urgent care to be exactly what the patient needs and wants, right? Patients go to urgent care centers because they're faster than an ER and they're more comprehensive than a minute clinic. So we have this opportunity to expand that sweet spot. We can differentiate from an ER by, kind of uniformly adopting online booking and on-time appointments, getting results quickly, making that imaging and all of that results portable. That's the kind of patient empowerment that we're working on here at Braid. I mean, imagine a world where a patient self-schedules, right, sees a provider efficiently without waiting, gets their labs and imaging immediately, gets those results on those tests in real time, and then leaves the center with all of that data on their mobile device, ready to go to anywhere they need to go next. I think we're leading the charge on that portability of data and allowing patients to have access even on their mobile phone. And this is the age we're in today. I think we need to redefine what we mean by quality when we think about quality care. And I think the urgent care industry can be that driver of change. Quality now means not just the right answer, but it's really the combination of the right answer right away to anyone who needs it. And it's that combination of accuracy, speed, and access that Blake referenced earlier. And I think the result is really greater patient acquisition and patient retention within that sphere. So we really have the opportunity to redefine ourselves, like you said, Brian.
Fantastic. Llewellyn?
I think reinventing urgent care means marshaling our collective abilities and strengths and relationships in new ways. We are no longer a small group of disconnected doc in the boxes just doing our thing in the local communities. Our responsibility is bigger than that now. We are a patient care powerhouse because of all that we can do. And a crucial part of the way that healthcare is delivered now. And we really need to fully embrace that position on a national scale. I think urgent care leaders are at the forefront of where patient care is going. And there's tremendous opportunity in that leadership role that we have in front of us to continue to innovate and show the rest of healthcare how this should be done. And the more collaboratively we do that, the faster we'll evolve as an industry.
Wonderful. Blake, your thoughts? As a health system?
Yeah, I know we've talked a lot about the digital space, but one thing we're working on is kind of rethinking our physical space as well. And, you know, really bringing it up to the standards, if you're not already doing so, to what the patient expects. So the patient expectation is huge. It's how, you know, the first thing they see when they walk in, and then also, you know, a way for you to really set the stage for then to introduce them to your people, which is the second thing we're focusing on. Not just our staffing, but making sure that everyone's working to the highest level of their license. You know, if we have nurses in our clinics, making sure that, you know, we're providing the service and have those things available for the patients. So really just doing a lot of kind of taking this time, while a lot of our team on the front lines, of course, you know, working really hard and treating everyone they possibly can. We have some people, I guess, such as myself and the digital innovation group at Providence, trying to figure out how can we leverage technology to rethink of our physical space, our digital presence, and make sure that we're supporting our providers and our caregivers at Providence.
Fantastic. You know, your health systems, you know, being 75 locations out Western United States, innovator, you know, how do you see virtual care kind of expanding in your practice? And are you concerned about reimbursement that might go along with that?
We're definitely keeping close tabs on that. We've had multiple platforms that we've used across the, you know, already set up before COVID even. Our Express Care, which is actually part of Providence, they're using a certain company that was actually, I think, created within Providence. And then they also have a lot of our primary care locations using another platform. So that's kind of where we are, is figuring out what's the best way to move forward as a system, which we can then thankfully scale a little quicker, being so, you know, as you said, kind of resource heavy. And yeah, just finding ways to, no matter what, just bring it back to the patient, making sure that we're providing a good experience and providing options for payment plans as well. So we do have, you know, discounted fee for service rate, of course, for patients who don't have insurance. And yeah, we just have a good team behind us, I think, to help track those resources and make sure that we're doing right by the patient.
Yeah, well, because it's a concern for the industry as we embrace technology as to, you know, what is the end result of this, especially with telemedicine. And again, I think that's the more critical measure as far as looking at what's the outcome of that. So really appreciate that, Blake. Finally to Roger.
Yeah, you know, just like Blake said, first impressions when a patient enters the clinic, that really matters. That's very important. And we believe, you know, increasingly urgent care is sort of the entry point for a patient that has a condition into the healthcare system. And that's increasingly so for many patients as they don't have, don't have primary care providers anymore. So urgent care is really quickly becoming sort of the face or the storefront of healthcare in the United States. Once a patient enters the system through urgent care, you know, they are then referred to, you know, wherever the primary care provider, the emergency room specialist, whatever the case may be. And that's really where the opportunity lies, we believe, for urgent care. So it must really embrace its role as this, you know, traffic control director of patient care, if you will. So at the same time, that really means that urgent care has to be better integrated into the healthcare ecosystem. It's just, right now, it's an extremely fragmented landscape. There's still a lot of, systems where, you know, there's onesies and twosies operated maybe by a provider, things like that. And that also means that health information is siloed and you're not able to share it. So while there's regulatory hurdles to overcome, we need technologies that help facilitate the continuity of care between these various specialties. And the ones that can do that, they'll be the ones that successfully will bring this fragmented landscape together. That is going to be more and more important as time goes on. Additionally, as I've mentioned earlier, COVID-19 has really fundamentally changed the urgent care business. And from an operator's perspective, from my perspective, it's important that we really embrace this new normal, that we do not believe that someday things will be just like they used to be last year or whenever that was. We have to embrace that our patients have new expectations when it comes to their medical care, and we really need to focus and cater to those new expectations. And as I mentioned, technologies, they have to stop being confusing for the patient in order for them to work. Just like the urgent care landscape, it's a fragmented technology landscape. And that has also its challenges. So the best technologies for us as an operator are always the ones that they just work, right? They perform the task in the background and they let us do our thing and let us take care of the patient and do our jobs. Those are the one technologies we appreciate the most. So it's really the job in the near term of the urgent care operator is going to be to integrate these various technologies and create this seamless experience for the patient as well as the staff. That's really important. So this is one strategic piece that certainly we will focus on and we believe will separate the successful urgent cares from the others in the near term.
Like, do you access specialists? Do you have like virtual care within your centers to access specialists as part of Providence?
We do. Telebehavioral health right now is kind of our top thing that we're working on in a lot of our markets. In Spokane, it's already set up. And then we have some other opportunities, I believe, kind of internally. Yeah.
Okay, last, I'm actually going to go finally to Llewellyn to give us a rebate. You've got the toughest challenge in pulling an industry together, pulling 3,500 members of UCA in the same direction. The gentlemen are on this call, or you're definitely poster urgent care centers to drive change and obviously visionary. So really interested in your feedback, Llewellyn.
Yeah, before I jump into that, I want to call out something that Roger mentioned that we haven't talked about a lot today, but I think is critical as we're looking at all of these technology solutions, and that is the staff. It is so easy to sit at the leadership level and say, oh, that looks really cool, we should get that. And then to watch it go through the full implementation to where you've got folks in the clinic during the day having to open the door and use it. Those are the people delivering the care. And so we really need to keep that usability at the forefront of our minds, that integration and the lowest disruption of workflow and that patient experience that we can manage is a critical piece of that. So Roger, I'm really glad you called that out. Brian, you were just talking about 3,500 members, and it's really, we've been doing a lot of math at UCA lately. And we probably have closer to almost 4,000 centers represented. And if you start to think about the people that are represented in that, because each of those centers, easily have a staff of probably 8 people, that's turns into a lot of people. And so I think that it is the people that makes this happen, not just, in the hands-on with the patient and the planning, the executive suite, but the connection between all of those, and the tight weave between the business side and the medical side of urgent care is something that's very unique to us. And I think we have an opportunity to leverage that even more fully than we have, particularly when we're making these technology decisions and even thinking about how we talk to patients and how we interact with the larger, healthcare ecosystem. The way that we show up for that is important about how the way that we're going to begin to be and continue to be perceived by the rest of the healthcare industry. I had a great conversation with a longtime UCA member the other day who's been in urgent care practically since the beginning. And one of the things he really called out that struck me is that as much as we've worked so hard to be part of the healthcare landscape, our real role, I think, because of who we are and all the things we bring to the table, is, as I alluded to a minute ago, to really show them how it can be done, not to blend in with what's currently happening, but to show a new way of doing things, to open their eyes to the great things that are going on in urgent care and how they can be adopted for the larger healthcare ecosystem. So I think that's part of our responsibility. It's not just awareness for the public and legislators and all of that, but really for everybody in healthcare. I think we have a huge opportunity here to show a new way that we already know works, because we're doing it all day long. So I love all the innovation that's been talked about today, and I'm excited about where we can go as an industry.
Certainly. I wanted to finish with you, Llewellyn, because again, you've got the challenge of pulling the industry forward. And it really is a task that I think you'll be up to. But I also think that really what we have going for us is in supporting urgent care is that there's a motivation to change. I can't cite any medical facility or any kind of medical business, a medical operation in the marketplace that could be redefined at this point in time than urgent care. It really has an opportunity. So the purpose of these type of webinars is to come together and further understand how we can work together, share ideas, help each other, grow as an urgent care community. It's in innovators, it's bringing together practitioners, it's bringing together leaders that really are focused on making change and positive change. And it can't be changed if it's not focused on as sustainable. And I think, again, what you're doing at UCA is building sustainable change, turning a big ship. And I think that you're in a position to do that. And we're all in support of you. So I know Connie has some final notes today. We really appreciate everybody attending.
We're honored to actively be helping support urgent care centers care for their patients across the country during COVID-19. So again, thanks for joining. And if you have any questions, please visit our website.